Welcome to another episode of Health Show with Amara. I'm Dr. Amara Sohail and I'm back with another very important health related topic. Today's topic is cervical cancer screening. As we all know, the risk of cancers is increasing and lifetime risk of any cancer in men and women is about 1 in 2. Some cancers are more common in women, some in men. Cervical cancer is one of the common ones. To discuss the cervical cancer screening and prevention, we have invited in our studios today Dr. Shazia Jaleel, who is consultant gynecologist from Midlands. Not only that she is a clinician, but she's also an honorary associate professor in Warwick University. She's got special interest in colposcopy and cervical screening. She's a lead colposcopy trainer and college tutor. Let's welcome Dr. Shazia Jaleel. Thank you very much, Dr. Jaleel, for coming to our studios to talk about a very important topic, which is cervical cancer screening and colposcopy.
Thank you, Amara, for giving me this opportunity. It's always a fun seeing you and talking to you.
Okay. So, Shazia, tell us about cervical cancer, how common it is and what are the risks?
Amara, cervical cancer, according to the WHO statistics, it is the 4th commonest cancer among the women, and it is a leading cause of death in women. So, worldwide, I would say that the risk of women of a lifetime of having a cancer is about 1 in 25. Whereas as compared to the developing world, in UK, the risk of lifetime developing a cancer is about 1 in 134. And the reason behind is that's because we have got a cervical cancer screening program, which is a very robust program. And in addition to that, we have got HPV vaccination as well.
Right. So, cervical screening program, what does that mean? When was that introduced and what does it involve?
It was introduced before 1988, and initially it was introduced with what we used to call as pap smear. Then later on, to improve the sensitivity of the program and to pick up more cases, we moved into liquid based cytology. Over the last couple of years, we have now moved into HPV screening only.
Right. So, what does that mean, HPV screening? What is the difference between the previous type of cervical screening program and the current one?
So, HPV has been found to be, it's a virus, it's a double stranded virus which actually lives within the epithelium of the skin, and it is present in more than 99.9% cases of cervical cancer. So, what they normally do now is when they do take a smear test, they test for HPV. And if HPV is negative, then the women, they get returned to their routine screening schedule. However, if HPV is positive, only then they look into these types of the cell, which is called cytology study. If the cytology study is negative, then instead of a woman going into their routine screening, they are offered a screening after a year. And after 3 consecutive tests, if it is HPV is positive and there are no abnormal cells detected, which is cytology is negative, then they get referred for further test, which is called colposcopy.
All right. And at what age do you start this cervical screening program in UK?
So, it started at the age of 25. So, when the girls are at the age of 24 years plus 6 months, they receive an invitation so that by 25 they had their first smear test. Following this, there's a 3-yearly screening up till the age of 49, and from there there's 5-yearly screening up till the age of 65. At 65, the women exit from the screening program provided her last smear has been coded as negative and last 3 smears are negative, and she was in her routine interval of screening, and the next screening test will be after 65 years of age.
All right. And you mentioned that we are fortunate in UK that in UK the risk of dying from cervical cancer is much lower than a lot of other low income countries or developing countries, and one of the reasons is, as you have mentioned, a robust cervical screening program, but you also mentioned about the vaccination. Could you tell us about the vaccination program, at what age the vaccination is offered, and what is the uptake of that?
So the vaccination is offered, again the vaccination program I think was started, if I am not mistaken, in 2008, and initially it was meant for girls only. But over the past several years now, I think in 2019 the program extended up to the boys as well. So now all the children between the age of 12 to 13 years of age, they have been offered the first dose of vaccination, and the second dose of vaccination is after 6 months of the first dose of vaccination. In addition to that, it has been offered to men having sex with men up to the age of 45 years, and also to elderly women who are at an increased risk of having cervical cancer. So this basically includes women with HIV.
So if with the current screening program, if a woman is found to have an HPV positive result, and you said then they are offered the cytology, would you tell us about what does that mean with cytology versus just the HPV virus detection on the smear?
So HPV is linked with cancerous changes. So I would like to talk to you first about what are the changes which are caused by HPV. So what happens is that HPV infects the skin or the epithelium, it stays inside there. Okay, so this is called the HPV acquisition. So once it's there, it is persistence. If it is persistent, then it causes precancerous changes in the cells. After 7 to 10 years, these precancerous changes, they turn into cancer. Now there are several different types of HPV, and it is a very common virus, Amara. So I would say more than 120 types of HPV are there, and some of this HPV virus are linked with warts, which is called type 6 and 11, and the other types of HPV which are called as high risk HPV, they cause cervical cancer.
Right, and so this virus, how is it transmitted then?
So most common route is the sexual contact. So it is spread by the penetrative sex, close intimate skin to skin contact, and by oral sex as well. Because this virus is found in vulva, vagina, penile areas, and also in oral cavity.
And is it more prevalent in a certain group of people, for example, who are more at risk of developing the HPV virus, or changes in the cells of the neck of the womb? So what are the vulnerabilities, or who are the people who are at increased risk?
Well, increased sexual activity, okay, and then the other factors which actually prevents clearance of the virus, which is immunosuppression. So among factors causing immunosuppression apart from diseases, obviously one of the major causes is smoking, which most of the women are not aware of.
Okay, and how does smoking then increases the risk of having abnormal smear?
So smoking actually prevents clearance of the virus, and if HPV stays over there for a long time, then it induces precancerous changes. The precancerous changes are divided basically into 3 types, just to make it more simpler. It could be mild precancerous changes, or moderate precancerous changes, or severe. If it is mild, then more than 80% of these cases they revert back to normal, and they revert back to normal in 2 years. So during this period, it is important if the women they abstain from smoking. And it has also been postulated that using condoms as a barrier method of contraception for 3 months can help in eliminating and reducing the risk of this virus. Moderate changes, traditionally we used to treat all moderate changes, but with the over the past couple of years, we have introduced the National Health Screening Program has introduced conservative management, because it has been found again that most of the moderate changes they revert back to normal in 2 years time. Okay. And then the treatment is needed for severe changes. It is very essential for the women to have treatment, because the risk of developing into cancer is high, more than 50%, but it takes about 7 to 10 years.
Right. So I mean, it's a slow growing cancer, but when a woman receives a result which is showing severe changes, of course, like cancer word itself is very scary, and a lot of women, they may go into denial and they don't want to accept it. And have you ever seen that women with severe changes, they are reluctant to come for treatments?
Amara, it's very common, and what I have observed is that even with low grade changes, women are very hesitant to attend the colposcopic examination. So we try our best, we send patient information leaflets to the women, And I think what is more needed is more educational program and more awareness. When they come, then it takes a very long consultation, and it's quite a private consultation which takes place. And because women are apprehended, we have got whole team. So it's not only a consultant, we have got clinic nurse specialists, we have got healthcare assistants which are over there in relating the anxiety. So actually when women they turn up with their smear report, they are so apprehended and they have got a lot of anxiety. The moment they sit down, they think that it's cancer. So then after a great deal of discussion, and sending them information leaflets, they come to know like this is not cancer, and even if it is severe, it takes about 7 to 10 years to develop into cancer. Sometimes the changes can be borderline as well. So borderline means that it could be normal looking cells, or it could be again different stages of precancerous stages. So it's very, very important to know that even it is high grade with severe changes, or what in the histology is called a CIN3, it does not mean that it is cancer.
Right. So do you think that this reluctance to come for further assessment or treatment, is it because of the denial, or is it because they are worried that the test they are going to have, which is the colposcopy, as I understand, they think it's going to be a very intrusive test, and it can be painful because a lot of women are very apprehensive and they don't want to go through any kind of discomfort or pain. So would you tell our viewers what the colposcopy involves?
So women are apprehended because it is an intimate examination, and they are apprehended with all the speculum examination. Okay, so but women they do they do undergo this examination, speculum examination, during a part of their pregnancy, and even with the routine gynecology clinic. So colposcopy itself is nothing to start off. It's nothing like when you are doing a diagnostic colposcopy, is nothing more actually than a simple speculum examination. What it actually involves is putting a speculum inside, having a look at the neck of the womb, and then using a spatial microscope called colposcope to have a look at the neck of the womb, so called cervix. So that microscope does not go inside, it stays outside. The only thing is that we have to use a weak vinegar solution called acetic acid, which can give a bit stinging feeling. And if there's a need to take biopsy, then we take a very small biopsy. It is as small as pinhead, and if women want, we can give local anesthesia as well, but because it is such a small piece of biopsy, most of the time it does not require, but there is an option of having local anesthesia as well. So and sometimes we do not even take a biopsy, that small biopsy, and because even if we see low grade changes, sometimes the women can just go and have a repeat smear in a year's time with GP. If they go ahead with the treatment, then obviously we have to give a local anesthetic, and then we use a heated wire to take those cells off. It is important to have this visit because, as I said before, in underdeveloped world, whereas there is no cervical cancer screening, the incidence of having a cervical cancer is 1 in 25, whereas over here is 1 in 134, which means in underdeveloped world, every 2 minutes a woman is dying of cancer.
Wow. And it is so, I mean, we are fortunate in UK that we've got a cervical screening program, but in a lot of developing countries this privilege is not there. So I mean, and of course setting up a screening service is not an easy thing. I don't know, how can we, being from a fortunate place, tell our colleagues abroad how to set up the service? Do you think it's a very complicated process and it involves a lot of money? How does it work?
Definitely it does involve money. I wouldn't disagree with that, and it does require a lot of efforts as well. So to start off, I think it will be to have a smear test and have a laboratory setup where they can assess the smear test, and secondly is setting up and doing a colposcopic examination. So the British Society of Colposcopy, I think they do provide assistance in going to the developing countries and helping them with the setup of the CME programs, and helping the setup of the colposcopic examination and how to actually start with the screening program. So this is something I think which we can look into it.
Yeah. And now going back to the colposcopic examination and treatment, you said. So treatment involves removal of those abnormal cells. Are there any implications of this treatment in the long run? Because most of these women who are having smears, they are young women who may be planning pregnancies and childbirth. So are there any implications of undergoing these treatments for abnormal smears?
There is a slight risk of having a preterm birth, which means having a baby earlier than expected, before the baby has reached the term of viability. So, but I wouldn't say it's a massive increase in result of a preterm birth. So, if we say that the generalized population risk is 7%, then for any woman who's having the treatment, the risk is just 1% higher, and the risk is 8%. It depends actually upon the length of the biopsy which has been taken for the treatment. So, most of the time the biopsy is under 10 millimeters. So, with under 10 millimeters there is no increased risk of preterm labor. However, if the biopsy is of a certain specific length between 10 to 14 millimeter, then there is a risk of 8%. So, generally there is only a very slight risk increase of having a preterm birth. There is obviously, it's a treatment, it's a biopsy, there is some risk of having infection and bleeding, but that's quite rare actually to have it. That's why we do it in the outpatient setting. And the colposcopy program is a very high quality assured program, and we are required to do 80% of cases under local anesthetics. So, and it's done in colposcopy suites.
Okay. And with regards to this screening program, are there any women or girls exempted from this program?
Yes, women who have no intimate contact with neither men or a woman, and women who had hysterectomy and the hysterectomy hasn't shown any evidence of CIN. Also, women with severe learning disabilities, they are exempted because for them examination can be traumatic and can be difficult. And in women who had female genital mutilation, because it is very difficult to have a speculum examination for those women, and also for those women who are declining to attend. So, the importance is that if they are declining to attend, they need to have a visit with the healthcare professional, somebody who has got a special interest in it, and to see the colposcope, to see people, healthcare professional, and once they have made a decision they do not want to attend, then the invitation is not sent to them.
Okay. And likewise, of course, what you just told our viewers, that the screening program starts at 25 and then finishes at 64, 65. Are there any cases where young women could be referred for a smear test for any particular reason, even though they may not have reached the age of smear?
Amara, it's a very quality assured program. So, because the incidence of cervical cancer is quite low in women less than 25 years of age, and because of increased risk of picking up HPV, even if you take a smear under 25 years, it is rejected by the lab. So, therefore, screening under 25 years is not recommended. However, if a woman is presenting with symptoms of cervical cancer, which could be a postcoital bleeding, in that case they get referred to the general gynae clinic, where they get assessed, and if from there it is considered necessary, like after having examination, if they think that the cervix does not look normal, then they get sent for the colposcopy examination. If we start screening everybody under 25, so then because HPV is so common, it will result in over treatment, increased anxiety, and the over treatment can result in compromising the reproductive outcome. So that's why the screening program has been limited up to 24 years and 6 months. Again, I would suggest with the postcoital bleeding at the general,
that means the bleeding after sexual
bleeding
activity,
after sexual activity, the commonest causes need to be excluded at the primary care first, which means the commonest causes are the infections and the hormonal causes. Once they have been excluded, if the woman is more than 35 years of age and is more than 35, then it has to be sent as a 2-week wait referral to the gynecology clinic. From there they can get assessed, and if it is considered to be very urgent, they are sent as 2 weeks, otherwise they are sent as a normal referral within 6 weeks to be seen in colposcopy clinic. If the woman is less than 35 years of age at GP practice and her smear is normal, then they are sent as by the GP, they should be sent as 6 weeks within 6 weeks.
I remember a few years back there was a media personality. She was diagnosed with the cervical cancer, and unfortunately she passed away. And that resulted in a lot of referrals from primary care as well as self-referral from young girls younger than 25 coming to the clinics because they were worried that they may have cervical cancer. So do you, and I remember that it was talked about that colposcopic services are really overwhelmed with these referrals. So do you think things have calmed down since then?
It's not only colposcopy services are overwhelmed. I would say the colposcopy services are overwhelmed, and there's a long waiting list, I think, in each of the other hospitals regarding colposcopies. It's because of HPV testing as well, because HPV testing is resulting in more women attending the colposcopy clinic. The scare is always there, Amara, whenever I'm not saying that there is no risk in under 25 of having cervical cancer. What I'm trying to say is that the risk is very low. So on the basis of one or two individual, if you start screening anyone, then basically we have to look at the pros and the cons. So the cons will be, you will be over treating the women. And these are the young girls under 25 because HPV is so common.
But then they won't. They can always argue back that yes, the risk is small, but what if it's them? It's one of them who.
I understand. Yeah.
So how do you satisfy them in that case?
So cervical cancer has got its symptoms. So that's why if somebody has got postcoital bleeding, has got abnormal vaginal discharge, they need to go and see the GP and get assessed.
Right. And
picking up HPV at a younger age, again, we can talk an hours about it, but picking HPV at a younger age can actually result in more hazard rather than benefit.
So Shazia, I just want to ask you one thing. When women attend for cervical screening regularly, does that mean that the detection for a cancer of the neck of the womb is almost 100% when they go for smear tests?
No, Mara, unfortunately not. The cervical cancer screening does not 100% prevents a woman in having a cancer. If a woman is attending screening regularly at the required level of the intervals, then the reduction is 70%. For a woman who has just attended screening once in a lifetime, the reduction is about 30%, and a woman if has attended twice in a lifetime, then the reduction is 40%. Unfortunately, it's not 100%.
Okay. And are there any situations or circumstances where for medical reasons you can exempt women from out of this screening program?
Yes, if they have already been diagnosed as cervical cancer. Secondly, if they have been treated with radiotherapy for any bladder, rectal or cervical cancers. Thirdly, if already had a hysterectomy, means total hysterectomy, where the cervix has been removed as well, and the cervix has not shown any evidence of cervical intraepithelial neoplasia, then they are not called for screening, and also male to female transgender.
Right. So since you mentioned this transgender or gender reassignments, so for girls who choose to change their gender, and we are seeing a trend these days that boys want to change into girls and girls into boys. So what happens? Do they automatically they are exempted from the cervical screening program, or they stay on the program?
So generally girls who go for a sex change and they go into they want to have a sex change, then they go for hysterectomy. So once they had a hysterectomy and if they have got a cervix removed, then yes, they are exempted. I just would like to mention it to you that hysterectomy could be subtotal, in which you leave the cervix behind. If the cervix is left behind, they still have to attend the cervical screening. Secondly, when the women they come for their pre-operative assessment visit and they have been booked for hysterectomy for any reason, it is important to check the cervical smear, and if they didn't have a smear, it's important to take a smear.
Right, and also for some of our viewers may be involved in taking smears. How do you optimize a smear that will not be rejected, or are they still rejected by the lab?
So first of all, it's very important actually to fill up the form with, which has got a little bit of history of a woman on the form with regards to her age and regards to her drug history and with regards to her menstrual cycle. For instance, like, sometimes you pick up the endometrial cells. So if endometrial cells are present in women more than 45 years of age, it's likely presence of a polyp or presence of a cancer.
And you mean the cells from the lining, inside
cells,
of the lining of the
cells
womb.
from the lining of the womb. So sometimes it is endometrial cells are the cells from the lining of the uterus or lining of the womb. So sometimes these cells are present and woman is more than 45. It does mean that women can either have a polyp inside the womb, or she can have a hyperplasia, which is a precancerous stage of the womb, or a cancer. However, if the same woman who is more than 45, she is using IUCD, or she is on tamoxifen, or she is on oral contraceptive pill, then it is of no relevance. So if you do not write the history, the interpretation will be difficult, and then you can miss things.
Okay. So thank you very much, Shazia, for a very, very informative and insightful session. But may I request you to give our viewers a message about why attending for cervical screening or smear test is important, and why should they not be afraid of coming to a colposcopy clinic if they are asked to do so?
Right. Thank you, Amara. Cervical cancer screening is very important because it can lead to, it is the commonest cause of the cervical, of the leading cause of the death in cervical cancer, and screening has got a 70% protection against cancer. We are very privileged to have a very robust quality assured and population based program here in UK and the other developed world. So and we need to consider, like, in those places where there is no cervical screening program, every 2 minutes a woman is dying of cancer. So and over here the risk of cervical cancer is about 1 in 134. Okay, and in the underdeveloped world is 1 in 25. So it's very important to attend cervical cancer screening. If you have any like post-traumatic stress disorder, or you have any unpleasant experiences in the past, please do let your secondary care know before attending colposcopic examination, because in that case we can make special arrangements and do a longer consultation for you and can make your experience a better experience.
So viewers, I hope you found this session insightful and clear about why it is important to attend for smears when called. So goodbye for now. I'll be back with another health related topic next time.